Good afternoon. I would like to talk to you for a few minutes about my research in the area of type 2 diabetes self-management. I'll start out with just a few statistics related to diabetes. In the United States, there are approximately 29 million people currently living with diabetes, and about 95% of those cases have type 2 diabetes. About 86 million people also live with pre-diabetes, and some of those don't realize that they even have pre-diabetes. Without significant lifestyle modifications, about 15 to 30% of those people will develop diabetes within the next 5 years. This is a slide from the CDC that shows the prevalence of diabetes in the United States and the increase in the numbers of people who have both obesity and diabetes that have occurred across a 20-year time period. We're keenly aware in the South, and particularly in Alabama, of the incidence of diabetes and obesity and how much it has increased in our area. So what's caused this increase? Well, primarily the lifestyle habits that we choose. In the United States, our diets are not very healthy. People in the United States, many people tend to consume too large portion sizes, and then physical activity is not meeting the requirements for maintaining a healthy weight. We used to think of type 2 diabetes as more of an adult disorder. It happened only to adult patients, but that has also changed over the years. There are now about 5,000 children diagnosed with type 2 diabetes each year. And you know why? Their parents are consuming these unhealthy foods. They're feeding them to their children. They see their parents heap on large portion sizes. They do the same thing. And then if the parents are not being physically active, then the kids are also less likely to be physically active. So my interest for caring for patients with type 2 diabetes came in my nursing practice. I've taken care of many, many patients with diabetes through the years, and just always enjoyed working with this patient population who has a variety of educational needs. The American Diabetes Association and the American Association of Diabetes Educators recommends that patients receive self-management education and support initially at diagnosis and then ongoing as needed to help them manage their diabetes and make all these day-to-day decisions that they're faced with in caring for their condition. The AADE specifically has 7 self-care behaviors that they recommend patients with diabetes participate in. And these include the ones you see on the screen: healthy eating, being physically active, taking medications as they've been prescribed, monitoring their blood glucose values, problem solving for those day-to-day issues. You know, you wake up with a stomach virus, do you take your insulin that day? Risk reduction behaviors, going for annual eye exams, annual foot exams to try to prevent some of the complications that occur with diabetes. And then also healthy coping to deal with all the psychosocial issues that develop in people who live with chronic illnesses. So my initial study was looking at relationships among these variables and found that self-efficacy was strongly associated with diabetes self-management behaviors. So I wanted to try and implement something that would increase patients' self-efficacy or their confidence to care for their diabetes. So we did a study at the Diabetes and Nutrition Center that's affiliated with East Alabama Medical Center. And we used an iPad application to track self-management behaviors. So participants logged their self-management behaviors each day, and the study results found that their self-management behaviors significantly increased in the second group of participants who used the iPads to track their behaviors. I have a couple of screenshots just so you can see what the app looked like. There are a gazillion apps out there now for diabetes self-management. So this is just one, and these are some of the areas where they can enter their data. This is a screenshot of the glucose tab where they can enter their blood glucose each time they assessed that at home. A significant takeaway from this study, some of the qualitative information that I got. Over and over again, people said to me, well, I really like this. You know, they said things like, it really helped me keep track of it. I found out that I wasn't doing as much as I thought I was doing for my diabetes. But lots of questions about diet. That is an area that people living with diabetes need continual support and education for. So I'm currently involved in a study where we've developed diabetes education modules, and those have been placed on iPads, and we're going out into the community and presenting that education to people in the community. So the educational modules were developed in conjunction with one of our graduate students in the School of Nursing, and then we collaborated with Dr. Richard Chapman and 4 of his senior design students in the computer science and software engineering. So we developed all the educational content, and they did something with the computer and put it on iPads for us so that it works. The name of the app is Diabetes and You. The School of Nursing conducts community health clinics or health promotion clinics all across Lee County and surrounding counties. These health promotion clinics are staffed by our faculty, nurse practitioner who's sitting in front of me here, and we take our undergraduate students as well as nurse practitioner students to these clinics, provide health screenings, blood pressure screenings, cholesterol, glucose screenings. So in these clinics, when patients are identified as having diabetes, then that gives me the opportunity to talk to them about their diabetes using this app. These are the areas that are included in the app, and you'll see that some of them are the same as the AEDE7 recommended behaviors. As we go through some initial questions, areas are identified with patients where they need additional education. So we may not cover all of these. If they're totally comfortable checking their blood glucose, then we may not cover that one. If they're not on insulin, then we don't cover that one. The one that we always cover, because they want to cover that one, is the healthy eating section. So I have several screenshots so you can see some of the content that's within the app, and we go through the content together and allowing the patient to ask questions. Also has some activities built into the app. This is one of the questions that's in the app. After we've covered some of the content, then there are different activities that they can do within the app. There's also a video, which I do not have time to show you, but there are videos like how to draw up your insulin, how to monitor your blood glucose. And this is another activity, so on all of the colored areas they can touch, and if it's an appropriate area for insulin, it will tell you it is, and if it's not, it will tell you that that's not a place for injecting insulin. So you'll notice from this picture, not all of our images show people of ideal body weight. Well, many of our patients in these clinics are also not ideal body weight. And so because we wanted to be able to relate to them, we included diverse images to try to reach out to people who are also diverse. And just a couple of more. One on checking your blood glucose. And then this is another activity where after we've covered the content on complications, they can tap on any of those question marks, and it will either ask a question that they need to answer, or it will just provide a little blurb of content. So as our health promotion clinics continue to grow, we hope to continue to involve an educational component for diabetes. I will be finishing up this study at the end of this fall, but certainly hope to continue to include that education in our clinics. Thank you.